Hello, you're welcome to my platform. I am Dr. Sandra and I am a surgeon. I hope you become aware and sensitized about the different surgical conditions. Today's video is about pyaemia. Pyaemia is when bacteria forms small aggregates or small clusters, and these small aggregates, these small clusters can escape into the bloodstream, and they can spread and lodge in different organs of the body. For example, the kidneys, the liver, the brain, the heart, and the spleen. The commonly implicated bacteria are the staphylococcus. Before these small aggregates, these small clusters of bacteria enter into the bloodstream, so they are transported into other organs of the body. They usually come from a given system of the body. For example, the urinary tract system, which is actually the commonest source of these aggregates or clusters of bacteria. But also other systems can be the source. For example, the lower respiratory tract system in the context of a pneumonia, or the biliary tract system in the context of cholecystitis, which is the inflammation of your gallbladder, or cholangitis, which is the inflammation of the common bile duct. The common bile duct, by the way, is just a tube that is responsible for the transportation of bile from your liver as well as the gallbladder. Bile, by the way, is a chemical that is required in the digestion of fats. When these small aggregates or small clusters of bacteria are transported by the bloodstream and they lodge into the different organs, they cause abscesses, that is, collection of pus in those organs. So eventually those organs can fail because the bacteria can cause destruction of those organs. So the organs shut down, and this can cause death of the patient. The individuals that are commonly affected by pyaemia include patients that have infection in any of their systems. For example, patients with UTIs, patients that have pneumonias, patients that have any infection in the gastrointestinal tract, as well as individuals that have infection in the biliary tree. For example, cholecystitis, especially the cholecystitis that is caused by infection. Cholecystitis, by the way, is the inflammation, that is the irritation of the gallbladder. And also patients that have cholangitis. Remember, cholangitis is the inflammation, that is the irritation of the common bile duct. The common bile duct is that tube that brings that chemical called bile from the liver into the intestine, such that it can aid in the digestion of fats. The other class of individuals that are commonly affected by pyaemia include individuals that have diabetes mellitus, especially those individuals that have an infection, for example, diabetic foot. That is when they have infection of one of their feet. Still, the bacteria can be taken into the blood in small aggregates, small clusters, and then it can be transported into the different organs of the body. Individuals that have a low immunity, for example, they have HIV, or they are on steroids or anti-rejection drugs. Maybe they underwent an organ transplantation. The signs and symptoms of pyaemia include on and off fevers, recurrent chills, rigors, tachycardia, that is a heart rate of more than 90, tachypnea, that is a respiratory rate of more than 24 breaths per minute, and hypotension. If the small aggregates or small clusters of bacteria are lodged into the liver, the affected individuals will present with jaundice. And if they lodged into the kidneys, the affected individuals might present with oliguria, that is a reduction in the amount of urine that one urinates in a day. And if they lodged into the brain, the affected individuals would present with drowsiness, headache, and sometimes convulsions. But in some cases, the bacteria can lodge in several organs. For example, it can lodge in the spleen, in the liver, in the kidneys, in the brain, the heart, the lungs. And so the patients can present with multi-organ dysfunction, that is, 2 or more of the organs failing or showing inappropriate functioning. The investigations that we carry out in Pyaemia include a complete blood count, a urine culture and sensitivity, a blood culture and sensitivity, and a pus culture. We can as well do investigations that are specific to the organ that might be affected. For example, we can do renal function tests to make sure that the kidneys are functioning well, and we can also do liver function tests to see if the liver is functioning well. We can as well do a CT scan looking out for pus collection in any of the organs. When it comes to the treatment of Pyaemia, we can employ the supportive management and the definitive management. And all these management approaches are done when the patient has been admitted. Under supportive management, we can employ a variety of approaches. For example, IV fluids, mechanical ventilation, oxygen therapy, and blood transfusion, as well as other supportive remedies that the patient might need dependent on the complications they have sustained. The definitive management of Pyaemia entails the use of antibiotics, and these are usually tailored by the culture and sensitivity results. And if the patients have the abscesses, these must be drained. When it comes to the prevention of Pyaemia, please make sure that you show up to the hospital for the treatment of any of the infections in any of your systems. For example, pneumonias, UTIs, as well as any other infections in any of your systems of the body, including the skin. The take-home message is Pyaemia can cause a collection of pus in the various organs of your body, and eventually the organs can shut down because the bacteria cause destruction of these organs. When the organs have been destroyed, the patient can easily die. If you see any of the signs and symptoms of Pyaemia that I talked about earlier, please come to the hospital for prompt medical attention. That is what I had for you. Thank you so much for watching. Please share my videos and also subscribe. See you in my next video. Bye.